Thank you very much for joining us for another episode of the Pulsebeat, sponsored by Cardio Miracle. Today I have the ultimate pleasure of sitting down with Dr. Jonathan Edwards. Dr. Edwards is the author of several books and medical papers, including The Revolutionary Ketamine, Stopping Pain, a revolutionary approach of beating chronic pain and increasing function. He practices medicine in Las Vegas, Nevada, and Port Orange, Florida. A native of California, he studied at Victor Valley Community College and the University of California at Davis and earned his medical degrees from Eastern Virginia Medical School. He did his residence in internal medicine in Las Vegas, physical medicine and rehabilitation in Utah, and neurology in Lyon, France. He completed his training in anesthesiology at the University of South Florida. Dr. Edwards lives with his wife and their daughter in Port Orange, Florida, and also part-time in the Provence region of France. Would love to, kick this off with, my version of saying hello, and we definitely appreciate your patience and everything that you do for the awareness and trying to get out to the world the wonderful healing of nitric oxide and the stopping pain. So first of all, I'd love to start by kind of going through some of your credentials. Can you maybe help us with some of those?
Yeah. You got you got it right. I mean, I'm a medical doctor, and I trained in anesthesiology. I also do chronic pain. I also treat suicide and depression using an anesthetic called ketamine. And yeah, that's, between those three, that's my primary practice, both, in Las Vegas and Florida at the moment. And then, besides that, I write books, and, I live part-time in the Provence region of France in the south there. So.
Awesome. That's incredible. And so I know you mentioned that you do consultations both in English and in French, right?
Yes, I do. Mm-hmm. Yeah.
That's amazing. And so how long have you been doing all this?
Anesthesia, almost 25 years going on. I've been treating suicide and mental illness for about 5 years or so, at least. And then the chronic pain, about with the technique we'll talk about. It's called Percutaneous Hydrotomy, and we talked a little bit about it at the A4M there. And about the same, almost going on 5 years now. I've been promoting that technique and writing books on it.
That's amazing. I love it. And so, I was going to say, as I've flipping through your Stopping Pain book, I appreciate you gave me one of these at the A4M.
Yeah, that's right.
It's such an amazing book, man. And so as I'm looking at your credentials and who you've worked with, and I mean, you do some work with like fighters with the UFC and things of that nature, right?
Oh yeah. I work with Misha Tate. She's a big one. I've worked closely with Gray Maynard. I've worked closely with Francis Ngannou. And I still work with the UFC Institute, actually doing their labs with Duncan French. And yeah, so I'm still, I know Forrest and the whole gang, and it's a good group, man. Yeah, so I'm pretty blessed to be in all that, and so again, I can't complain.
No, it's amazing. And so, as a kid, I got in this heated argument with one of my friends, and in a restaurant in Vegas, actually, and he punched me in the face. And so I'm wondering, from your point of view, from dealing with these people that's their living, is getting hit in the face, and it's like a terrifying kind of thing. But how have you helped people kind of bounce back, especially fighters in particular? How have you helped them bounce back from injuries and any of that, PTSD? Do you do that as well?
Absolutely. There's two great topics right there. Yeah, yeah. I mean, absolutely through, I did in Utah, I did a year of physical medicine and rehabilitation, which is basically a year of non-operative orthopedics. So that's where I get a lot of my sports medicine and all that. And then plus I was a former professional athlete in motocross, growing up until I was 19, just trying to make it as an aspiring professional. And before I went to medical school. So, the mindset is where I guess I connect most with the professional athletes because I get it. I know what they're trying to do. I know they're trying to come back as soon as humanly possible. After ACL, getting their knee reconstructed or bone breaks, or a lot of overtraining in the UFC as well. So you're always, I'm always checking labs, like iron levels, what's their hormone levels, their electrolyte levels, protein levels, checking for overtraining factors, like Epstein-Barr, or sometimes the inflammatory things. And, and a fighter gets sick 2 weeks before the fight, usually they can't pull out, or it's a big deal. So if you're trying to optimize that. And so a lot of it's just, just training, fatigue management, and sometimes it's accelerating injury recovery, which I can do. And so that brings in like the percutaneous hydrotomy, and I write, about that. I have a great story about one of the fighters, TJ Dillashaw. A lot of people have heard of him, and he had a shoulder injury, and he was about to fight. If I remember correctly, it was first fight back, and his shoulder he pulled his teres minor really bad in one of the rotator cuff, and it wasn't torn, but it was definitely strained. And so we did the hydrotomy on him, like on his shoulder 5 times before that fight. We had about 6 weeks, and I worked with his coach, who's Coach Cal, or Sam Calavita. He's a owner of the training lab there, and so he and I work closely with TJ. And yeah, I pulled out all the stops, and at the end of it, his shoulder was the least of his problems. Yeah, and so he helped. He did videos for us and everything, and they're on my YouTube. But so in short, let's go back to what it is. It's just it's utilizing the subcutaneous space over the injury and placing water. So that's physiologic saline, anti-inflammatories, local anesthetics, sometimes a low dose of steroids, although not in the case of most fighters. And arthritis, you might do that. But you also you go with naturopathic principles like minerals, amino acids, pentoxifylline, which is a kind of a vasodilator, procaine, it's another local anesthetic with more than just properties, has immune healing properties, and much more. And so you throw all that into it and just let it slow release. And then the biggest thing is like, it allows greater function and decrease of pain. So what does that do? Lets you complete rehab. So it's not a miracle. It works. It works physiologically, and it's a logical solution, So, and it's the same way. It also, same kind of thing, you're doing with nitric oxide uptake, it's like, and then we always throw them in the hyperbaric chamber right after. So it's not just that, it's one of those pieces of the puzzle that gets people back into, function. And I've used the hydrotomy on several, of the UFC athletes, with success, and as I said, it's not a miracle, but it's just one thing in the ingredient, of the buffet of things you can do for somebody's pain to get them back where they need to be. And yeah, so that's it. I would say that is percutaneous hydrotomy in a nutshell. So
Sure. That's amazing. I love it. And so, as you mentioned nitric oxide in there, and obviously, yeah. My ears are gonna perk up right there. So, when you discovered nitric oxide and the effects that it was having on, mm-hmm. Healing or whatever, how was that? How have you kind of incorporated that in your practice?
I'm also a Category 1. I used to be I used to be a Category 1 bike racer. So nitric oxide has been something near and dear to me since I've been racing bicycles at a very high level. And then and and since you're in Utah, you'll love, I used to do whatever I could do to increase my nitric oxide for altitude, because I lived in Las Vegas. So I was training at about like 2,000 feet. But then we go to the high Uintas, or, I did, the Snow Valley hill climb and, with the tour of Utah, that kind of stuff. And I mean, so you're going up to like 10,000 feet up there, and then, yeah, you start, if you don't have a good nitric oxide system, you're usually just going to fall off, So I mean, I would be taking everything. I mean, beetroot shots. I mean, sometimes nitric oxide stimulators. I didn't have Cardio Miracle at that time. And then but now I get all my athletes on it because it's not just healing, it's also function. So I think the way to explain nitric oxide, like in when you're at cycling, is it allows you to hold that. It doesn't allow you really give you more power or a higher VO2 max, but it gives you a better tolerance of just holding that power for a longer time if used correctly. And then the other place I'll use it I think we discussed a little bit is in the sport of motocross and supercross. I mean, like tomorrow is the Daytona Supercross, and those guys in the main event are basically just pulling a 20-minute VO2 max from start to finish at a heart rate, at the max heart rate the whole time. So anyway, yeah. So that's why we add in some of these kinds of things, like, the nitric oxide optimization, bicarb, certain sugars and glucoses. It just depends, but on each rider. But yeah, that's some of the strategies. So I can, so it's near and dear. I've been doing it a long time, and that's why I was attracted to what you did right away.
Sure. I love it. Yeah. Thank you. Well, our missions definitely align. I mean, it's, our mission is to save 100 million lives. It's to save the hearts of mankind. And obviously with yourself, you mentioned a little bit to me, especially in some things that you're passionate about discussing are just what's been going on, especially these, more recent years, and with the, the health and wellness of people around the world and everything. And so could you speak to that a little bit about how how passionate you are?
So I went to a rally. So I got a great story on that. I went to a rally called Rescue the Republic, and that's where RFK spoke, and about when he aligned with President Trump. But before that, I was involved in his openings for running for president, and that was in Boston, and then Philadelphia, and then in Boston when he announced the independent run, and then later on he aligned with Trump, and then the Make America Healthy Again. I've been involved with that, and when I was at the Rescue the Rally, I met the lawyer Diana Lutfi and she wrote the amicus brief for what was called the Scarametti versus U.S., and that was the Supreme Court oral arguments against the transgender medicine for minors. So I wrote a piece in that. And anyway, from that stemmed my connections into what's called the RFK Health Policy Institute, which she is in charge of. And that's all being born right now, we'll say. It's on its way. And I actually just went to CPAC, and that was an interesting experience. I'd never done that before, seeing real politics. I'm not sure it's for me, but it was an interesting deal. But but the point is this health policy institute is going to do some very interesting things. And as chronic disease is still freaking 40 to 60%. I mean, 60% of people over the age of 65 cannot get up off the floor with one or two hands, right? I mean, 800,000 people a year die of some cardiovascular disease. It's just, it's just all, it's just all that. And how are we going to fix that? It's going to be through being able to have conversations and fix people's nitric oxide systems for sure. That's absolutely part of it, along with vitamin D and all the rest. And, just getting people to exercise again, move again. And so I'm proud to work with Diana, on this, and I'm working with some Nobel laureate level researchers too. And so there's many goals in there. And one goal is to heal the divide, between Nobel laureate researchers and say people like Sayer G, who's more in alternative medicine. There's a big divide right there. And so that's one of the goals. The other thing is like repurposed medications. For autism, for example, there's a ton of medications out there that exist that are sitting on the shelf. And we know some researchers who have the ability to do legit experiments and screening of these drugs. And hey, can you help? There's even things for nitric oxide out there that are sitting on the shelf right now. That doing nothing. There's drugs for autism, and there's a drug that will cut lung inflammation by a huge percentage. Again, not available, sitting on the shelf. So repurposed drugs are I think a great thing to highlight and bring awareness about, so to speak, So I don't know. Yeah. So those are some of the things. That was my journey into, say, the new health movement, and we'll see where it goes. But yeah, that's kind of what I'm up to right now.
Yeah, I love it. It's like your personal, your Jonathan mission, of making America healthy again. It's like you're like doing it. It's amazing. So can you help us understand the benefits of a hyperbaric chamber?
Yes. So let's, so we existed. So we all need ATP, right? Nitric oxide and all the other metabolisms have to do with what is your energy currency? Well, that's ATP, adenosine triphosphate. That's like your body's money. 7 seconds without it, you're dead. Period. So it's what our mitochondria produce, all that kind of thing. So I work with Scott Schur, who hosts the Smarter Not Harder podcast, and he's one of the world's experts in hyperbaric medicine, and I work closely with him. And basically, you need a body that's optimized. So you got to be able to use a hyperbaric environment. So what is a hyperbaric environment? That's defined as an enclosed space that has increased pressure. And what does that simulate? Depth below the sea. So a bunch of water on top of you. It's the reason seals and whales can, go underwater for so long, because they increase their plasma oxygen. So a hyperbaric oxygen increases plasma oxygen. And by doing that, you provide more oxygen, not just what you breathe, but also every cell. So every cell now has a higher concentration available of oxygen to it and in it than it did before. So your heart's pumping out a heck of a lot more oxygen. Now, where nitric oxide comes into this, it's a great hack. You can actually use drugs like Cialis and even Cardio Miracle before a hyperbaric chamber, because what does a hyperbaric chamber do? With the increased oxygen, it actually constricts some of the blood vessels, and you can actually open them up in a sense, not completely, but more than they were before with nitric oxide stimulators. And guess what else? Guess what else it optimizes? things. If you saw the blood flow, say to your, well, your penis, for example, or your erectile tissue, it the difference between when you go into, you already know when you take, nitric oxide optimizers, the blood flow goes up there. But when you mix that with a hyperbaric, it's like 400% or something like that. And there's great studies, and Dr. Schur talks all about it if you follow him. But so it's a neat little thing. And I actually have a hyperbaric oxygen chamber in my garage that I use 3 to 5, sometimes 3 to 5 times a week. It depends. And obviously, for long COVID and even any infection, that takes you out, hyperbaric oxygen is something to consider, and obviously in diabetic wounds in hospitals, strokes, heart attacks, you name it. If you can involve the use of a hyperbaric chamber, you're going to be better off than if you did not.
Sure.
And there's so there's a lot of links, of like increased oxygen, increased nitric oxide, and it also stimulates bone marrow development and the release of stem cell factors. And it's just there is so much more to it that it's definitely worth the discussion. Yeah. And if you ever get Dr. Schur on here, I think that you guys would be he's a great podcast speaker, and he'd be
that sounds amazing.
So that's what the hyperbaric chamber is. It's just basically a place of higher pressure, increases oxygen concentration within the body, and helps stimulate more ATP production, in the most basic sense. And it's, so there's more to it than that, but that's HBOT in a nutshell.
It's amazing. I like it. And what other products I know you mentioned Methylene Blue and were there more that are kind of your staples that you have?
Yeah,
as
it depends. I'll use, not everybody, but I'll use Methylene Blue in a lot of people, especially head trauma. So you mentioned before, like the head trauma and like the UFC. CTE. Chronic traumatic encephalopathy is a real thing, and I've had a couple athletes actually take their life because of it. And it's like, that's why I treat people with ketamine, which we'll get into. But, when you think of like CTE and head trauma, Methylene Blue is just another thing that it's a drug, it's a medication since the late 1800s that it goes directly into your electron transport chain and helps optimize ATP production. Again, and again, I preface that with you need to be adequately, say, optimized, vitamins, all that kind of thing. You can't just throw it at a broken body and expect miracles. That's not the way it works. Sometimes you got some homework to do before some of these things like HBOT or Methylene Blue or, whatever, IV vitamins or whatever you want to do, actually are going to work. And I would say that's the same for nitric oxide. You throw nitric oxide stimulators at a broken body, it's not the best that you can do. Let's put it that way.
Sure. Yeah. And what I tell people a lot of the times is that, it's great to have something like Cardio Miracle, that this nitric oxide, this product that creates and generates and sustains nitric oxide. It's nice. Obviously, it's kind of a mulligan, if you will, but it's not going to be the only thing that you need to do. Like, I can't just take Cardio Miracle and go out and eat a pizza every night and think that I'm not going to gain any weight or whatever. And so
I liked it, man. I was pleasantly surprised. I have to say, I did it. I exercised with it, and then I was like, man, this matches. The other powerful nitric oxide things I've used. It was it matched it just fine. I was like, man, this is all, vegetables. And I I was like, man,
Yeah. Yeah,
I was,
58,
yeah,
58 whole fruits and
I was
vegetables.
really impressed. I appreciated it. And, so yeah, I can, and I'm not, you don't, it's not like you guys don't sponsor or anything. I was impressed. So yeah, good job.
Well, that's good to hear. Thank you. We appreciate that. And so, what we've seen with some of our dentists and chiropractors and people that do practice some type of healing and medicine that they are saying that it's the Cardio Miracle is helping with receding gums and dentistry and it's actually
Mhm.
helping with holds with chiropractic that actually will hold the adjustments will hold longer than normal. And so it's really interesting the science behind nitric oxide and how effective it is. And so we're really honored that you would give it a shot. And
Yep.
it's exciting. We'll have to get you on a 90-day supply and have you back and see see how you're doing. So it's really
Okay.
cool. But no, we appreciate that. And also with your mission and with trying to help people with like the long haul COVID and everything, like what have you noticed the most as far as like the healing goes? How long is that, like a kind of a blanket time frame that you've been able to help people, or is it
Just
more
depends,
case by
I mean,
case?
it's long haul COVID is really a misnomer. It's just post-infective chronic fatigue. I
Oh,
mean, it can happen with anything. It can happen with a flu. It can happen with, bronchitis. It can happen with a pneumonia. It can happen with whatever. I mean, it's just after the infection is gone, you have a state of fatigue. And usually that's, you got a suboptimal production of ATP from your mitochondria. Usually it's, a mitochondrial centered problem. So you do things to help the mitochondria, and that's doesn't all happen at once. And that's where giving some high dose vitamins and getting them in the sun, optimizing vitamin D, not just at like you may hear standard medicine, which is really called sick medicine, and you got to start thinking health medicine. So you got to get your vitamin D's in like 90s and 100, for example, not 50. There's you gotta dose the exercise back into it correctly, using your sensations and good variable pace training, and so you let somebody, like you push them and then you let them recover, you push them and you let them recover. And that's all work based off Dr. Balat in France, and she calls it variable pace training, and we wrote the Science of the Marathon together for that. And but that's another key factor that can get people back from chronic disease. Methylene blue, that's another thing that can stimulate ATP production. You get people off, you get them off the sugar, and you get them, more fat adapted, so to speak, optimized fat metabolism. Something I've done with a guy named Peter Defty at OFM for a long time. And, it's so, I have a lot of people I go to, and then they kind of coach people, and I'll kind of direct their labs. Um, and then the other thing you got to make sure is, like, let's say you do have a chronic thing, you got to you have to rule out, is it a heart thing? And most people don't even ever think to do like a stress test. I mean, running on a treadmill with a bunch of EKG pads can tell you a heck of a lot about the state of your coronary arteries. And that is huge. And I can't tell you how many blockages I've actually found doing stress tests and what are called coronary artery calcium score studies. And you have a blockage in your coronary arteries, as you know. I mean, nitric oxide is one way to help it, but if it's chronically blocked, your energy is going to be chronically depressed.
sure.
So, a lot of people don't, you get all these health coaches, and I mean, they don't have the ability to write those prescriptions. So, but I advocate that a lot for my patients. So optimizing your cardiovascular system is really huge, and then the there's always biological, and then there's psychological, and then there's the spiritual side, and you just got to get people to believe in themselves or something higher, and then usually that they can run with that, and that's when you see people getting past the chronic fatigue, thing, and I've seen it last for months and months and sometimes years. So I mean, yeah, there's a lot to it, and then like we'll do some, I'll do some higher level testing, like from Genova, called the NutriVal, for example, and that goes way beyond some of the LabCorp testing you can do, or Quest or whatever. What are your amino acid levels? Using arginine, as is a big nitric oxide stimulator, right? And so, I mean, and then yeah, now people love the idea of the Cardio Miracle, and again, I'm not selling it. I think it's a good thing to use, and people just love the natural part of it. So that's an easy thing to add in there. Yeah, and then and most people don't get enough protein. The whole RDA of like a 0.6 grams per kilogram of protein is just ridiculous. I mean, people like Keith Barr and Stuart Phillips say you need like a 1.5 to 2 grams per kilogram of body weight. Ideal body weight for your protein supplements. So most people are chronically undernourished as far as when it comes to protein, and I see a lot of changes with that. So it's just you could just keep going on and on and on with it. But it's a multifaceted problem, this whole chronic fatigue thing. And there's some other alternative things that actually were at A4M, like at Quicksilver, like the Canton salts are really good. Those are we're made up of the same milieu of salts, of sea salts, right? I mean, start listening to people like Chris Shade and all that, and I write about that in my Stopping Pain book. The whole idea of where Canton salts even came from, and it just happens to be the guy was French, René Canton, and he did that research back in the early 1900s. And it saved generations of babies from cholera and kwashiorkor and malnutrition. These subcutaneous injections and oral administration of these, basically filtered sea salts. There's little. I guess to go even deeper, there's little argument that we came from the ocean. So our constitutions are very similar. Kind of gets in the weeds, but if you go, there's some legit Nobel laureate research into that, and it's fascinating. So anyway, I hope I didn't go too far.
I love it, man. I love it. We can all go down the different rabbit holes, right? But I love it. I think it's so interesting, and it is so important, and that's so. Something about me, and I probably breezed over this when we were at A4M, but I used to almost be 500 pounds, and so I was a strongman competitor, and I was lifting cars and flipping telephone poles, and it was just here locally, but hurt my back and kept eating 10 to 15,000 calories a day, and I blew up, right? And so now that I've lost almost 200 pounds, and I've done a lot of it with Cardio Miracle at the Cornerstone, because while I'm fasting for 20 hours a day, it actually was helping me satiate me, and I was fine. And then what was happening, if I would take Cardio Miracle while I was fasting, it actually draws the vitamin D from my stored fat cells and utilizes it. And so we actually have these studies that we've had done. We've had 4 separate studies done on Cardio Miracle and how it does both generate and sustain nitric oxide, and also how it utilizes our stored vitamin D. And so, as you have talked about a few times about people being deficient in vitamin D, what are some other ways, aside from going outside, exercising, and utilizing quality supplements? Are, how can they get more vitamin D in their diet every day?
So some people are so malnourished that you actually have to inject it.
Oh,
So you actually use an injection form of like CoQ10 and vitamin D, and that will pump up somebody's vitamin D levels pretty quickly. And of course, you can use high dose oral, like 50,000, like 10, 20, 50,000, 100,000. So I might, depends on the situation. But especially like during COVID, I was giving injections, hands down. Yeah, I didn't fool. It was no fooling around. Um, and I'm not saying that's for everybody, but it's definitely something that can be done. And most quality compounding pharmacies make it, and so it's something to look into. I've had a lot of good luck with it, and I've measured the levels afterwards, and it'll pump up the levels quite quickly. And it's a great example. You have to have adequate vitamin D to have good nitric oxide function. It just goes hand in hand. That's part of why good vitamin D levels work.
right, right. And so kind of another personal one is I've always had this kind of shoulder pain, as you can
Mm-hmm.
probably see where I'm going here. But it's like when I'm lifting now, I'm in the gym every single day, 6 days a week. While I'm lifting, the part of me that stops is because my shoulder is just hurting. And so I'm wondering if that's more of a rotator cuff thing, or if that's just like an old football injury from college, or you probably do you hear that a lot about the shoulder?
Yep. Well, so frozen shoulder, I mean, you may have calcific tendonitis, which is also called frozen shoulder. And that's pathological calcium deposits that happen in the tendon and muscle. And you can see it on x ray often. And this is something that in my book I address in Stopping Pain, but uh, and there's peer-reviewed, randomized, controlled studies on this, like giving what's called magnesium, a local anesthetic, bupivacaine with saline, and a chelator called EDTA. And that can, after 6 treatments, actually reverse the calcium buildup in those tendons and actually free up the shoulder. And I've done it to many people. I'd say the procedure, the hydrotomy or percutaneous hydrotomy, works very well for that. And if anybody wants to look up the studies, you can look it up. It's it's all related to mesotherapy, and it's through a guy named Dr. Caccio, and he did it in Italy. But there's other studies besides that, and I wouldn't. It's one of the pictures I like showing most. So anyway, that's like probably be almost number one on the differential diagnosis list for you. Two, you could have chronic rotator cuff tendinopathies or damage of the rotator cuff. Whether it's supraspinatus, infraspinatus, teres minor, subscapularis. Three, you could have acromial impingement. Usually you have a combination of all of it, right? And then 4, you can also have osteoarthritis of the joint itself. And it just depends. When you've been torquing it that long, it's just that's why you got to get the MRI and good physical exam. And I always work with good orthopedists who, so I'm not guessing. And then yeah. So, but so where would the percutaneous hydrotomy fit on that for you? After we did some research and diagnostic studies, it would fit in the buffet. It would fit in somewhere in between, say, doing nothing, letting it rest, to doing surgery. You got steroid injections, you got sometimes PRP, stem cells, percutaneous hydrotomy fits in that. So, it's a regenerative injection technique.
Sure.
And you just,
Okay.
the cells are pissed off. Plain and simple. They're wanting,
pretty pissed at me, I'm sure. Yeah.
they need things, amino acids, they need, trace minerals, they need water, they need, sometimes they need to be calmed down with anti-inflammatories. What's amazing to see is like when you do something like percutaneous hydrotomy to a shoulder, is to watch somebody go back to do it and then they go back to rehab that day or the day after, and they can get double what they could get done normally. And so, I mean, that's, just think about that, being able to do more rehab than you could have otherwise, say, taking ibuprofen or even worse, so, Percocet. That's the other thing, is that these kind of procedures decrease opioid consumption, which, as you know, we're losing 110,000 people a year to opioid overdoses, mostly fentanyl. And it's just, it's heart breaking's not even a good enough word for it, right? It's just unimaginable, really, why we're here. But doing procedures like this can decrease opioid consumption, and if you don't see the logic in that, you're just willfully blind at this point. But
right. Some people say ignorance is bliss, but no, that's what I'm talking about. Like, I mean, I can, still, like, in the gym when I'm busting out, I only do 225. That's as high as I'll go on like a bench press or something. But if I calm myself down, but I got up to 15 the other day and my shoulder felt like it was going to fall off, so I was
really?
like, I got to stop. Yeah. So
yeah, you got to get it. Yeah. You know what you got to do. We'll talk more about it, but there's,
offline. Okay.
yeah, just give me a call. We'll get on a call. Yeah.
Yeah, no, but I love it. I love it, Jonathan. Thank you so much for your time, man. I appreciate it. And where can people find you? Where can people find your writing, your books?
Yeah, I'm on Substack, Jonathan Edwards, MD, at Substack. I have my website, same thing, Jonathan Edwards, MD. I'm searchable. It's just you can see it on Amazon for the books. It's just mostly Substack is where I enjoy putting out content, I suppose. And yeah, so I'd say that's the main two. And I try to do social media, not too much. Social media is a hard, can be a nasty thing, it's like,
that's necessary evil sometimes, right? But
it is. It's a necessary evil that I'm keeping my daughter away from. It's like Jonathan hates my anxious generation. He's one of my idols, and I follow it. I really try to do that with my daughter, and I think everybody should hopefully see. If they want to learn more about it, that's a good place.
Heck yeah. Yeah. Thank you. And did you just get back from France, or were you somewhere else?
I was just in DC, and then before that, I was in Vegas. And then before that, I was in France. Yep. And then I go to France again in April, I think. And so far, and then, so I'm hopping around. I fly quite a bit, which has its own stresses.
Sure. Yeah. Definitely. Well, yeah, thank you so much again for your time. I appreciate you so much.
Yeah.
And it's been such a pleasure to learn from you, and we're really excited about it. And are there any parting words you have for us today?
No, I mean, I think, if you just aim up, a lot of things come into place, and that means a lot of different things for a lot of different people. But I can tell you, whenever I think about doing things for my patients, I ask myself those questions, and I think if you do that, you're gonna find the right direction, and get better and live a better life. That's how I would put it.
I love it. Yeah, that's what our goal here is with Cardio Miracle. I mean, we call it a hope in a glass, and we want to.
That's cool. Hope is good.
Yeah, hope in a glass is good, right? And so we're definitely trying to help everybody learn that nitric oxide was called the spark of life in the cell. And so We want to make sure that everybody knows it. We thank so much Cardio Miracle, our sponsor. Thanks so much for your time, Dr. Jonathan Edwards, and hopefully we can do this again sometime. Sit down and learn more.
Anytime. Thank you for having me. It's great.
Yeah. Thank you guys very much. It's Josh Hewlett signing out with the Pulse Beat, and we appreciate your time. Have a great day, everybody.